that's a growing problem. Fully vaccinated people who test positive for COVID-19 are called breakthrough cases. And since January of this year, the city of Houston reports more than 3,100 of those cases out of the nearly 1.5 million fully vaccinated Houstonians.
The state of Texas started tracking some of this data back in February. They have just 343 recorded cases of what they call clinically severe breakthrough cases. As you can see, there's not a complete count of these cases.
So tonight, KPRC 2 investigator Mario Diaz reveals just why that is and the efforts to get a clearer picture of these infections.
How accurate are officials with these breakthrough numbers?
I don't think that they know for sure.
This is the challenge regarding breakthrough cases. We've heard more about them of late, but what you probably have not heard about is the system used to catalog these rare cases.
Unfortunately, right now, we are not systematically tracking breakthrough cases, not in the county, not in the state, and not in the nation as a whole.
Dr. Caitlin Jedalina is an associate professor with the UT School of Public Health. She also has been an advisor to Harris County regarding its COVID response.
It is an oxymoron that we are the leader of medical and scientific discovery in the world, and we can't track it.
There is no one single way by which we can track this today.
So then how is there any accuracy in this?
It's, again, estimations.
Let's work back to front.
Dr. Joseph Verone has been relentless in battling COVID at United Memorial Medical Center. Verone says breakthrough cases are small in comparison to the number of unvaccinated people being overwhelmed by the Delta variant. However, Verone says a centralized system to track breakthroughs is needed.
We need to have a uniform message or a uniform way of tracking things.
There is some data being collected, but health officials admit the system is limited. This is because the Texas Department of State Health Services only counts breakthrough cases that result in hospitalization or fatality. The state is simply following what the CDC called for this past spring, according to Dr. Jedalina.
They decided in May very clearly that they weren't going to follow mild or moderate breakthrough cases. They only wanted to know about hospitalizations and deaths, and that continues to be an issue.
But what about the vast number of positive breakthrough cases that don't result in a hospitalization? Those cases, if logged, are key to understanding the virus's impact.
I want to know what kind of vaccine is the one that is not covering as much.
We need the data available to track how well the vaccines are working.
Should the CDC recalibrate their system?
Yeah, 100%.
We appreciate it very much.
U.S. Representative Sheila Jackson Lee is the congressional chair of the bipartisan task force on COVID.
I'm not satisfied.
Lee is in favor of a centralized system.
It is an issue that is front and center for me, and over the next couple of days, I'll be talking to our leadership to ensure that they move the ball on this issue.
We know that there are going to be many more variants, but we need to learn more as to what works, what doesn't work.
It is challenging to find a positive in any COVID diagnosis. But Dr. Verone says he has noticed a big one in COVID breakthrough cases. They are far from deadly. In fact, Verone tells me that he has yet to have any fully vaccinated patients die after a breakthrough diagnosis. Mario Diaz, KPRC 2 investigates.